Welcome back at 8:14. When it comes to maternal health, Louisiana ranks highest in maternal mortality in the nation, and 1/3 of the state's parishes are considered maternal health deserts, meaning they do not have at least one OBGYN in the region. But registered nurse Tiffany Webb joins us this morning during this Maternal Fetal Health Month to explain how a new clinic in New Orleans East aims to improve these outcomes. We appreciate you being with us this morning, Tiffany.
Thank you, Kelsey.
So before we talk about this new clinic that is now officially open in New Orleans East at the hospital there, let's talk more about maternal fetal health. When we talk about that term, what does it entail exactly?
So maternal fetal health is high risk. So these are the patients who come to us pregnant with risk factors that are outside of normal pregnancy. So they can include diabetes, high blood pressure, genetics, multiple births, which are fun, and just even outside of just age factors, which is called advanced maternal age.
They don't use the term geriatric pregnancy anymore. Is that a term we're kind of phasing away from?
They use it, but I like to use advanced maternal age. It's nicer.
I agree with that. So when someone comes in for an appointment and they fall under this umbrella, some of those categories you just mentioned, what does an appointment look like that may look different than a regular OBGYN checkup?
Well, maternal fetal medicine, we're a specialty clinic. So you have to have a referral from your primary OB physician. So care has to be established prior to an appointment with us. So the OB sits down with the patient. They are the one who diagnose the patient with any disease process or any complications, and they send a referral over to us, and then we get an appointment scheduled with the patient.
And the appointment, of course, would vary or how the appointment looks would vary based on the patient and what their needs are based on that initial OB appointment, correct?
Absolutely. So it depends on what the patient has going on. It can just be coming in for labs, it can be a consultation, or it can actually be a procedure. So it varies based on the diagnosis.
And the good news is there is now a clinic right in New Orleans East that addresses a lot of these, we don't necessarily want to call them issues, but they can be maybe complications in a pregnancy. It's open now at New Orleans East Hospital, and there's a ribbon cutting tonight celebrating the opening.
Yeah, so yeah, we're very excited about that. New Orleans East is one of the communities that we have a high mortality rates in diabetes, and hypertension in pregnancies. And we find that the outcomes will be much better for moms and babies now that we are providing these services in the community.
And it's right in the hospital, so you come in the hospital,
right in the hospital. It's right on the second floor. We do have our ribbon cutting ceremony tonight from 5 to 7, and we welcome the community and our moms and their families to come on board and enjoy this special moment with us, guys.
And again, talk about how important it is and how wonderful it is that you now have this. We now have this clinic right in the heart of New Orleans East, and really that's not too far from other people who live in the metro area either.
Yeah, so we find that not just New Orleans East, we're providing service to. The Slidell community, the Chalmette community, the Gentilly. All over, even Mississippi. Our doctors that they do get referrals outside. So we're providing a closer service in coming uptown community. So everyone's very excited about that, especially being that this is the first high-risk pregnancy clinic that we can provide service since Katrina. So yes,
wow.
Our LSU docs are very excited about that.
This is a major deal. Open already, grand opening celebration tonight, but if people want to start finding out more information, where can they go for more details about the services you all provide?
So again, you have to have established care with your primary OB doc. We do provide services there right now on Mondays and Thursdays. Our section head, Dr. Robert Marpin, alongside of our assistant section head, Dr. Asha Hurd and Dr. Davis, and we do have a nurse practitioner, Angela Byers, who follow the patients as well. So we're there, we're open, get your care established with your OB and have that conversation and take advantage of the opportunity to visit with maternal fetal medicine.
Well, Tiffany Webb, we appreciate your time this morning. So excited that clinic's open. First one since Katrina. That's a huge deal.
Yes,
we appreciate
Kelsey.
your time this morning.
Absolutely. Thank you for having me.